In Tripoli, we have like two centers, Tripoli Medical Center and Central Hospital of Tripoli. We have another center in Benghazi and one in Sabha, and another small part in Western Mountain in Garian. So these are the only centers that treat people living with HIV. They have like, it's not really center, it's only department in these centers. Usually the country runs a mass screening. Like if you are applying for a job, they're gonna ask you for a medical health certificate, marriage. If you are like, we have like system, you are obliged to go to the military for training, like for a few months. So all these things requires health certificate, so you have to do it. By this way, usually people discover that they have the virus. This is the main reason. Or when they are going to be admitted to the hospital, or going under some procedures like endoscopy or minor surgery, they have to do the test. No, all the tests are with names. It's
Okay.
named. The other reason is the stigma discrimination thing, and because the test is with names and everything, it discourages people to go to run the test. And the worst part is that there's no pre or post test counseling. So if someone like he goes to the lab, the nurse or lab technician runs the test, and after a few days he comes and collect his data or his test results at a small window. If he's positive, he will just handle him the results and ask him to go to the infectious department. Actually, this is one of the worst parts, even before the war. The NGOs or the social society, civilian societies has no activities or have no actual rule, especially in HIV/AIDS. There were only one NGO in whole Libya, and they provide very little support. Actually, they are not doing a good job. Basing or it's not based on the guidelines, like because they need sometimes to check if this drug has resistance or not, but they don't have the test for this kind of. There's no genotypes in the governmental section. There's only very few in private section, and it's very expensive. It's about, let's say, about $800 or something like this. So not everyone is able to. Even PCR, by the way, the government uses it to do it. They use to send it abroad. Like they collect some samples and they do it like once, twice a year, something like that. But in the private sector, it costs us around $150. So again, not everyone is able to do it. Well,
No.
usually they depend on CD4 actually.
Yeah.
Like for example, if the CD4 is less than 350, they're gonna start treatment with plus to some symptoms. They're gonna start treatment. If it's up to above the 350, there's no symptoms. They will not start treatment. Honestly, first and second line usually they are available. But again, there's like interruptions in the treatment. Third line, honestly, I don't remember exactly, but again, if it's, during the report, when I did the report, there were a lot of stockouts of all the lines, either first, second, or third. Procurement process, they are still depending on the old primitive techniques. They don't have health information system. They don't know how many needed or exactly how many needed or how many they spend already. Sometimes even the government, sometimes they give them expired medications because they don't have any. But people, what they do usually, they ask their friends if they have some left for like a couple of days, couple of weeks until something will, like miracle happens or something. Some of them try to, borrow some money or something to buy it. Some of them have money, so they can buy it. Some of them, like they like during the war maybe, or other situations, they went out to Tunisia or other neighborhood countries to ask from some of the NGOs if they can give them some, but unfortunately, um, it's not possible. They don't give, unless, like, for example, people from this, only for those who are from the same country. Yep. It's kind of personal effort, let's say, personal effort by the doctors themselves. They just try to, as I told you, try to manage to stay in the guidelines, but it's not. It's hard to stick to it, actually. So they sometimes just try to change the medications, and after a couple of, let's say, weeks or months, maybe they will check again the CD4 and the general health or the general condition of the patient. And if it's working, then it's working. Otherwise, the patient will get worse. Stigma and discrimination actually is a very important issue, starting from the general population, but the worst part is the stigma and discrimination among the medical personnel. For example, some surgeons refuse to operate on on people living with HIV. In OB/GYN departments, they have very they treat them very badly, usually by the nurses, by the doctors. Sometimes, they put them in certain place. They are not giving them the actual support that they need. Even in the infectious departments themselves, they still face big problem because it's mostly related either to injecting drug users or injecting drug by needles, or injecting drugs, or by sexual workers. So, yeah. And this issue actually it become the main reason or the main obstacle for people to go to follow up, to get tested, and get treatment because of this issue. So that's why maybe I'm more interested on working on decreasing this stigma and discrimination thing more than working on getting the drug itself. Because even if the drug is there and nobody is able to get to these medications because of stigma and discrimination, then we are doing, it's like we are not really helping.